Ms. Wild, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Secretary, thank you so much for being here. I want to shift gears entirely to a subject that I find of great interest, mostly because it's something that has been highlighted to me by my constituents on so many occasions, and that is the issue of postpartum mental health. And I know that the National Maternal Mental Health Hotline recently updated its number to 1-833-TLC-MAMA, which is great. And as I said, I've heard from so many women about postpartum experiences that have been very, very difficult. And so I'm happy that there is now a 24/7 free telephone line that connects these mothers with professional counselors who can provide emotional support and so forth. For any mother who might be listening in today or might see this hearing in the future, is there anything that they should know about this important resource that your department has provided?
Congressman, thank you for the question. Absolutely, that they should know that if they reach out and call that number, there's a good chance that we'll be able to direct them to services that they can utilize to make sure that they're taking not just care of themselves, but of any family member as well. And so we encourage them to use the hotline to find out what services are available to them.
Well, I promise you, my office will make sure that we are pushing the availability of that number out. It's something that I was not very aware of prior to this. And then I just want to switch gears to the Low-Income Home Energy Assistance Program, otherwise known as LIHEAP, which, for those who are watching, provides federally funded assistance in managing costs associated with home energy bills and weatherization and that kind of thing. And it's something that in Pennsylvania, many families are relying on these investments to lower the cost of staying warm, or in fact, to receiving heat at all in the winter, or staying cool in the summer. The President's proposed budget would allow LIHEAP grantees those funds to assist low-income households with their water and wastewater utility bills, which would be something new. Can you talk about why that would be important and about LIHEAP generally and its successes?
Congresswoman, first I have to thank you and many of your colleagues for giving us the additional resources in LIHEAP to actually reach out and now expand the scope of services. What we're finding is that many Americans are suffering, in some cases dying, because of heat or in some cases because of cold. And what we want to do is make sure that the LIHEAP program is there to help them as best possible in the way they need it. And so for some, it will be an issue of heat. Some, it will be an issue of air conditioning during the summer. Some, it will be making sure they can stay warm and get the type of heating that they need. For other folks, it may be something different. As you mentioned, now water. We're trying to make sure that we don't forget that people have to have access to potable water that's safe to drink. And if you can't drink safe potable water, you're in really big trouble. So we want LIHEAP to work for families where they are, and we will let those on the ground that actually administer the programs determine how best to utilize those LIHEAP resources.
Well, it would seem to make a lot of sense. Most people are aware that energy costs, whether it's gas or electric, to help with air conditioning and particularly heating in the winter is incredibly important. But a lot of people don't think about the necessity of water to every single human being and how expensive it can be. And can you talk, again, getting back to my interest in maternal health and postpartum health, we know that maternal exposure to heat is associated with an increased risk of preterm and early term birth, low and decreased birth rate, weight, stillbirth, and harmful newborn stress. Can you talk about the importance of continuing and expanding the LIHEAP programs generally, especially as it relates to vulnerable populations, and if you could focus particularly on expectant mothers and children?
And I know you know this, my wife who's an OBGYN can tell you this as well, that a woman goes through significant stress during pregnancy. And the last thing you need is to have that stress compounded by a lack of heating or a lack of air conditioning in hot temperatures or a lack of access to potable water. And so LIHEAP should be there to help. And again, let those on the ground who know how best to use the resources with families in their jurisdiction determine how best to use those LIHEAP dollars. And certainly when it comes to maternal health, the The last thing you would want is to have a woman who's stressed because she's already pregnant now have to stress more because she doesn't know how she's going to.
And it's not just emotional stress. We're also talking about physical health during pregnancy, right?
Both.
Okay. Thank you very much, Mr. Secretary. I yield back.
Thank you, Ms.